So there is an exciting study that's been completed. It's called the ASCERTAIN trial, and it's a phase 3 randomized study evaluating essentially oral decitabine. But it's a combination of cedazuridine with decitabine, and it's an oral formulation of hypomethylating therapy. The trial gave patients either oral decitabine, oral cedazuridine decitabine combination upfront, then followed by IV decitabine, or IV decitabine followed by the oral administration of the cedazuridine decitabine compound. And one of the endpoints of the study was to follow what we call the half-life or the pharmacokinetics of the drug. And that tells us how well the drug is being absorbed. If the drug is present within the bloodstream at equivalent levels, then the route of administration should not matter. Now, that's a statement of fact, but it is important to say that it's not necessarily a fact. And there are some who might argue with that statement because just showing that the blood levels are equivalent from people doesn't necessarily answer all the questions that you might have in regards to how the drug works. So, for example, does it result in similar survival rates? Does it result in similar transfusion independence rates? These are questions that people might have about the ASCERTAIN trial. But right now, we can say that it met its primary endpoint in showing pharmacokinetic equivalence between the oral route of administration and the IV route of administration. And the reason why that's exciting is because patients do face challenges in coming into clinic to receive a medication. And obviously, if they can take a pill formulation, that would be less challenging for them. And it would also likely improve compliance. And there are some who might argue that the oral route of administration could result in longer duration of exposure. And that is actually the longer duration of exposure that will result in the best clinical outcomes rather than the peaks and valleys that patients get from an IV administration. But that last component, which I'm discussing now, really needs to be borne out through further follow-up and more data. So I think we have to be very cautious when we look at how we interpret the information we have. And we can't necessarily say that the oral route of administration is superior yet. But that is what people might hope for, is that if we can deliver a drug in a more continuous way, in a more continuous fashion, we can potentially improve response rates. But we don't know that for sure yet.
In terms of clinical efficacy, the data, of course, that has been presented in the American Society of Hematology meeting in December 2019, that was the first analysis from the trial. Subsequent analyses are going to continue, but it does sound like the activity with the oral decitabine is somewhat similar to the IV decitabine in terms of the complete response rate, transfusion independence, as well as overall survival. Of course, to get a very definitive sense of that, you need a randomized trial of IV versus oral, but that could take many more years. And I think this approach of looking at pharmacokinetic equivalence was a smart approach to make the drug potentially available faster for patients and to give them that alternative. For hypomethylating agents, I think the development of oral versions have been one of the more, I think, in my view, one of the more important developments in the field of myelodysplastic syndromes. I think the development of CDIC, which is an oral version of decitabine with cedazuridine, which is an oral agent that inhibits the enzyme that metabolizes decitabine in the stomach, in the intestine or in the liver. So because of that enzyme, we are not able to give decitabine by orally. However, with the use of this agent, we are now able to block this enzyme, and that allows the absorption of decitabine, and therefore it can be given orally. And I think that's important because it allows the administration of the drug without needing to have an intravenous access and potentially without having to come to the clinic frequently.